Hey everyone, Dr. David Sugar here again with UnProcessed Sugar. Thank you so much for joining us. We have a really exciting episode today, psychedelics and mental health. You may have seen in the news just a few weeks ago, an executive order was written by the president to fast track research in the areas of psychedelic and mental health. Going back to around 1970, President Richard Nixon signed the Controlled Substances Act, which basically threw the baby out with the bathwater. It lumped everything together. Heroin, psilocybin, LSD, all got lumped together. All research basically stopped a little over 50 years ago, which was a massive disservice to the field of psychedelics and mental health. Well, an executive order was just recently signed that's going to fast track researchers' ability to do these studies and get things to market. There have been some going on a little bit here and there that we'll talk about, but now it's the doors are open and we're going to see a lot more advances in the field of psychedelics and mental health. So along the lines of that, I have Dr. Jordana Hollen, psychiatrist here in Sarasota, Florida, a very dear friend of mine who has been kind enough to join us and share with us some of her wisdom.
Thank you for having me.
Absolutely. I know your schedule is crazy busy. So
Not crazier than yours.
I don't know about that. But again, I really appreciate you joining us and taking the time out of your schedule.
Thank you for having me.
So first up, what are psychedelics? And it's kind of a big generic catch-all phrase, but basically they're substances, chemicals, medicines, plants that alter our perception of what is around us, our senses. It alters our mood. It alters our level of consciousness. And a big one for terms of mental health are patterns of thought. A lot of times we get stuck in these loops, and that leads to a lot of our mental health problems. And what psychedelics do is they can help to break that pattern of thought. But a key is that they do these things on a temporary basis. They don't necessarily permanently change things. And for the most part, they work through some of the neurotransmitters, in particular serotonin. So we'll talk a little bit about that, but I'm really excited to talk about a part of Dr. Hollen's practice, which is ketamine therapy and ketamine treatments, which have become very widespread. They aren't a true psychedelic, but they allow the brain and the therapist to basically accomplish the same things that some of the more classic psychedelics can do. There's a part of our brain in the way that it works, default mode network. And basically it's where we get caught in these patterns of repetition. And so Dr. Hollen, imagine in your practice in patients with various mental health conditions, that seems to me that's probably a pretty common thread, that people have these repetitive thoughts, these loops they get stuck on. What can you kind of expand upon on that?
Exactly. That's kind of how I refer to it, a loop where you can't get out of that loop. It's like the circuitry is going and going, whether it be anxiety, depression, and that anxiety can lead to depression. Depression can lead to anxiety. When you're running this mental marathon, per se, it becomes physically exhausting, mentally exhausing, and you can't break that loop as you referenced.
Okay. And you kind of briefly mentioned physical. So I think that's an important thing to understand, is that this isn't just mental. They actually have an impact on our physical well-being as well.
Absolutely.
All right. And so when I say to myself, okay, I'm stuck in this loop, I mean, what that would be an example of like replaying negative thoughts or
any sort of intrusive thoughts,
okay.
Negative thoughts, right. Negative self-talk, okay. A breakup someone can't get over, a job loss, okay. Anything, tangible like that. Or it could just be, because someone has such low self-esteem, right. They have those negative cognitive distortions that are constantly, that, they don't have those positive to fill in.
Right, okay, that makes sense.
They don't have the positive in their arsenal to plug in.
Gotcha. And it seems to me that becomes a self-perpetuating problem then. You have this anxiety, so you're stuck in this loop and you're thinking these thoughts that make you anxious, but the mere fact that you keep doing that makes you even more anxious.
You can't get out of it.
Right. Okay.
Yes.
Gotcha. So, how do the traditional psychiatric medicines help that process, or do they even help that process?
They absolutely do for a lot of people. They do. And, I'm not going to discredit their value. Sure. They help stop that loop. Serotonin can certainly help stop that loop for OCD, anxiety, panic disorder, generalized anxiety disorder, patients who really have a tough time, not because they're deficient per se in that neurotransmitter, they just benefit from having it around a little bit longer.
Okay, I gotcha. All right, good. And it does, as I mentioned, it seems to me to become a self-perpetuating problem. Anxiety begets more anxiety.
And then you lose confidence.
Right.
And that even further, feeds into that loop and that self-loathing. And, I like people to have a goal, as we mentioned, an intention, as you called it, which I really like, when they come in for therapy. And
absolutely.
so we can discuss that.
Okay, very, very good.
Yeah.
Intention, that's a concept that I've learned recently, and it's not some big elaborate thing. I'm trying to work on it more, but for me, it's as simple as when I start my day off. In a positive way, it's almost like a mental to-do list. What is my intention? My intention isn't to take the garbage out, but my intention is to maybe think positive thoughts, maybe affirmation, things like that.
Start with a grateful heart. Start the day with, an open mind. If you start the day, mind over mood. If you start the day that it's going to be a shit day, excuse my French, it's going to be a shit day.
Exactly.
Fake it till you make it. There are studies that show that if you start the day, even if you don't believe it, you say, today's going to be a good day. That it's going to be better than if you start the day off saying today's going to be a shit day.
Right. And I know that there are some times that I'll wake up and immediately I'm like, and that's a horrible way to start your day. You're starting it off on a negative tone.
It's hard to stop those patterns, especially when you're feeling down and out. And, after a long interval of feeling down and out, you need something to break that cycle.
I heard a phrase from a gentleman named Rich Roll. He has a podcast. He's pretty well known. I'm going to make sure I get it right. It's action begets mood.
It's the same, actually, with people they did studies of people who were frowning versus people who were smiling. Even though they were fake smiling, it actually caused an effect on mood. So scores on mood, so it's reading scales.
But action begets mood. So you start off with a little simple action.
It may sound like BS, okay, I'm going to wake up and I'm going to smile, like I'm going to cheese it like Chandler and I'm going to feel better, but it actually works.
It does actually work. It's a little bit of the concept behind make your bed in the morning. It's a little win. Just start off with something small. And I say that a lot. Start off small. It doesn't have to be a big process.
That speaks to the intentions, which don't have to be huge. And then they can lead to other intentions.
Exactly.
So I like that.
So when in your work with patients, that's where the therapy part comes in. It's trying to teach them better habits, better mindsets. Excuse me. Now, taking the traditional medication, like the SSRIs, Prozac and Zoloft and those things, do they have an impact on that neurologic loop, or do they work in a different manner?
So when I think about ketamine patients, and I reference that because that's what I use at my office. I think of patients who are stuck. They have tried the traditional medications and, we've set intentions and it ain't happening. For example, someone who just can't get comfortable with themselves, just being quiet. There's so much noise. They can't just sit. They feel unproductive unless they're doing something. So ketamine, I have found for this particular patient and actually several others, it gives them that space to feel what that actually feels like.
Okay.
That peace, that quiet.
Right.
And they say, I did not even know that existed.
Right.
So for those patients, they're able to, it's working, I think, in a multifaceted way. One, they now know it exists.
Okay, right.
It gives them hope that it exists.
Right.
And then they can use that point of reference. This neural pathway has formed, and that's huge.
Yeah, right.
Forming new neural pathways where, okay, now my intention is to go home and practice this. And use neurofeedback, use certain techniques, biofeedback to get back to that, knowing I can do this.
Okay, good. That's awesome stuff. And that kind of leads me to a topic where all these kind of, how these work is a concept called neuroplasticity. Yes. So for our audience, we used to, when I was in medical school, nerve cells didn't heal, nerve cells didn't change, new neurologic connections were never made. And we now know that's not true.
The exact opposite.
Exactly right. So the concept is neuroplasticity, getting back to what you were just saying, where your brain can now literally rewire itself. And that's the big common denominator of how psychedelics work. They give your brain, your nervous system, the ability to rewire itself. They will make connections with other parts of the nervous system that
have never connected
exactly.
before.
So,
yes.
But it's temporary, and then you've got to do the work to tell it what to change to. So.
That's key, doing the work, so that it sticks, so that you don't just have this experience in the office, and then there you have it, okay, great, insight and awareness, as we know, is like only a small fraction of the battle. Then it's, I can do this.
Gotcha. So this loop it's kind of rigid. I mean, you're stuck in these rigid ways of thinking. You can't process trauma, for example, because you're only looking at it in one way, from one perspective.
Maybe your brain won't even allow you. Maybe your intention, you came in and your intention was something totally different, and you tackled that, and then you shift. To trauma because the ketamine has allowed you that that ability to relax enough, to become comfortable enough, the flexibility in a sense.
Right. No, that makes perfect sense. So the big areas that I'm learning are being addressed with this are things like anxiety, depression, PTSD, some OCD, generalized anxiety disorder. So the psychedelics temporarily allow your brain to rewire, to make connections they otherwise couldn't make. But that's only half I don't want to say battle, but that's only half the job. It's not a cure in itself. We now have to do the work.
Do the work.
So I think of it, my neurologic system is now open. I'm open to new ways of thinking about things, new ways of doing things, and starting a different loop, breaking the old loop and starting a new loop. So I want to kind of tell a little bit about some of the stuff that's being done out there.
Of course, it's exciting.
Very exciting. There's an organization called MAPS, M-A-P-S, Multidisciplinary Association for Psychedelic Studies. And it was formed by a gentleman named Rick Doblin, who is a graduate of New College here in Sarasota. I actually met him at a conference I was attending in Miami. And in 1986, the United States government made MDMA, ecstasy, they made it illegal. That's the same year he formed this organization called MAPS. And then they have been the ones who've done the major groundbreaking research on PTSD.
But we're really halted.
But exactly. We're limited on how much they could do. And that's what this executive order is going to now do, is allow them to open up the research pathways. So, excuse me, there was a study done a few years ago with the VA, so it's government sanctioned, government funded, and it was the most successful treatment outcome that anyone's ever had for PTSD for these vets. couple years later, they got the same group of patients together, looked at them again, and they still had the same level of success. So now I think they're going into phase 3 studies, and I'm not the best at what's 1, 2, and 3, but I know that 3 is right before
3 means business.
Right, we're about to go to market as soon as we can, as soon as they can finish these studies. Now, ketamine is the one that's accessible. It doesn't have to be in a study. So
it's FDA approved in the intranasal Spravato S-ketamine form.
So I've got some issues. I've got this loop. I'm stuck, and I come to see you. And then how's that whole process work? I mean, you obviously have an intake, and you help me sort out what's going on. But what's the process for someone who is interested in doing a ketamine therapy, and how does it work?
A lot of times I really want to get to know the patient. Sure. I want to know what their intentions are. Even though we may not know all of their intentions at the start, I don't want it to be that they see ketamine as this quick fix, and I also don't want to, for lack of a better word, call it the retox clinic, where now this person is on ketamine for life, because that's not the goal either. I want to pick the right patient with the right symptoms, who's motivated, who has some goals, who's ready to roll up their sleeves, do the work.
Right?
Yes,
yep,
exactly.
Okay.
So that's part of the intake process. A lot of the people that I've done this with, I've gotten to know them fairly well, in that I've been meeting with them, and certain traditional medications just have not gotten them to the point where, say, for example, that patient that I referenced earlier, the noise quieted. It put the dimmer switch on 0. Noise is
down.
Okay. Yes. So, this works fast.
So the ketamine is done in the office.
In the office.
You don't give them a script. They go to the pharmacy, get some ketamine, and go home and hang out.
I start in the office. Okay. I like to get a dose that I feel comfortable with. The patient feels comfortable with. Monitor, vitals. You have to check blood pressure, and some people really want that hand holding. Some people want just someone there to be quiet the first couple sessions. Some people want to process things afterwards. Sometimes I add during a session because someone's a little tentative about dosing. So, we don't need to go all out. We don't need to get to the edge of glory and then, puke by any means. It's really not as if you have to push it really far with dosing to get the benefits, I found. And so that's one of the reasons why I like the troches, because it's very controlled in dosing.
And that's the lozenge you put in your mouth.
The lozenge, exactly. You have to do the lozenge a certain way. You got to make sure that it absorbs quickly. Otherwise, you'll get some of the funky metabolites, and you might not feel so good. But if you take it quickly and absorb it quickly, then you're going to get all benefit. You check in on certain intervals, how you feeling, and it's the noise is completely gone. Something that this patient has never experienced in their entire life, with all the different psychotropics they have tried.
Holy smokes!
Yeah,
and then that can be even on the first treatment session. That can happen.
First treatment.
Wow. Okay.
First treatment. You see numbers on these scales, these rating scales. PHQ-9, that's standard for depression, and then GAD-7, standard for generalized anxiety disorder. They'll come in, high numbers. They leave with zeros.
Oh wow.
And you want that to stick.
Right. So then they are coming back on a certain frequency, or it's not a one and done thing, right?
It's not one and done. So I have people journal a lot. I like people to take rating scales with them. I like them to come back in for, it's not like see ya in 3 months. It's let's talk about, how this experience was. And sometimes people will dictate, they say, I want to think about this a little bit,
Yeah, sure.
or I want to come back in 2 days and do this again.
Okay.
So I like to think of it as getting someone to where they find a good regimen, and then coming up with a maintenance, and then kind of phasing out.
Okay. So they do get to a point where they don't need the ketamine anymore. They've the rewiring has taken place.
Yes, they've done the work.
Sounds to me that there's a lot of them learning new skills, new ways of thinking, breaking that loop, right?
Absolutely. It's not as passive. There's a passive part where it's you take the medication and you had no idea that you could feel that comfortable. But then there's a lot of work to be done on the patient's end, and that's why picking someone who's motivated, who's the right kind of patient who wants to do the work is going to give this longevity, is really going to take it to the next level.
That makes complete sense. And that's what I've kind of learned with all the other psychedelics and my learning of this and research is that, okay, great, you've got this substance, a medicine, plant-based a lot of times, that is going to allow your brain to rewire, but you have to do the work to tell it what to rewire to.
I've spoken to many people who've done mushrooms recreationally, and someone used this description that I thought was interesting. This is someone who was doing it without the therapy, the psilocybin assisted therapy. It was as if someone went on vacation and had all those experiences while they were on vacation, and then re-entry into life, and then it was cool. I went on this vacation.
Right.
And I have memories from the vacation, but did it really stick?
I gotcha. Okay.
Did it really change my way of thinking?
Right. Probably not.
Probably not. I mean, we go on great vacations and we have great experiences, but does that change the loop?
Exactly. Okay. Very, very good. There's a few other studies that I'd like to just mention out there. Johns Hopkins, I think 2016 did a study on end-of-life anxiety, people with stage 4 cancer, and this isn't theirs was with psilocybin, and just for our audience to know, this isn't a situation where you're given a prescription, you go to the pharmacy, get 20 hits of psilocybin, and go have fun. No, it's in a clinical setting. You're in a somewhat non-sterile clinical setting, but you're in a therapist's office. A nurse may be there to monitor vital signs. A therapist and or a MD or both. You do both, and then they're there for 4, 5, 6, 8 hours.
Very controlled,
right? And the one study in particular out of Johns Hopkins, these people rated that experience with the most spiritually impactful experience in their whole life, only second to the birth of their child. Right. Pretty heavy duty stuff, right?
And think about what's at stake. These are people who are dying.
They're dying. And it took away their fear. Okay, I'm going to die. I can accept that now. And it stinks, but it's okay. And their anxiety and their fear was really, really calmed down. That dimmer switch.
Well, how compelling is that? I mean, comparing something that is, for some, the most, elating experience of one's life, and then you think death. But to get someone to that place during death.
Pretty powerful.
Yeah.
Pretty powerful. There's a clinic in South Florida that's doing studies with generalized anxiety disorder. And there's some places doing what's called microdosing. I don't know if microdosing is something you ever do on a regular basis with ketamine, but microdosing for our audience is you take an amount of the medicine that is subperceptual. In other words, you feel nothing. For all you know, you didn't take a thing. And you take it, there's different schedules. There's Paul Stamets, who's huge in the psilocybin world, has a protocol, and 3 days on, 4 off, 3 days on, 4 off, things like that. And you get that rewiring, but again, you've got to do the work. The maps we talked about with the PTSD, and then there's a substance called ibogaine that Joe Rogan talks a lot about. They spoke about it at the press conference a couple weeks ago, and that is a plant, the bark or the root of a plant in South America that they make a drink out of, and people have one treatment and they're off their opiates. And it's unbelievable. In the sense of the word unbelievable, it kind of is unbelievable. Like I don't know if I really believe that. But it's been well documented. It's anecdotal. There's not studies yet. But
if that comes to fruition,
Right.
if that has some power to that study.
Exactly right.
Yeah.
And it's not just the withdrawal symptoms that were alleviated. It was the way of thinking. The cravings were gone, and again the loop was broken.
So it's multifaceted.
Exactly right.
Yeah.
You know, RFK Jr. Tells a story about one of his sons. And I don't know, he has like 9 or 10 children, and his wife had killed herself, and his one son was just in a very bad way, withdrawn, aloof, deep depression, and unbeknownst to RFK Jr. at the time, he went to one of these retreats in South America, and they call it ceremony when people do it with the shaman. People hear about ayahuasca, which is DMT, right?
I was thinking ayahuasca.
And it's a shaman's like a medicine man, and these people have done it for millennium. Maybe not millennium, but for centuries. And it's called ceremony. And he went and did that and came back, and RFK Jr. said he had his son back. Completely reversed how he was feeling, his state of mind, and he was back to his old self again. On one treatment.
That's unbelievable.
Right. It is unbelievable.
My dad, who has never smoked even like a joint in his life.
Right.
I know growing up he smoked cigarettes, but he's, as straight as an arrow when it comes to drugs.
Okay.
He saw his best friend dying of cancer, and psilocybin was incorporated into the mix. And after that, he had a totally different feeling about all of this. He said, he has a Southern accent. He said, "Don't get me wrong, Jay, I'm not going to do the goat."
The dope. I'm not doing the dope.
The
right.
goat.
Right.
Ayahuasca. He called that the goat.
The goat. Okay.
The goat.
Gotcha.
But he saw how psilocybin really changed, the process of the death of one of his dearest friends, and it took away the fear.
Right.
And so he did a lot of reading, and that was seeing it play out live for him.
Right. Right. Firsthand. You saw
Firsthand.
that. Yeah,
yes.
that's pretty wild. I know there's some other studies done with macro dosing, meaning one dose, one big dose, where you are tripping, if you will. And but I think to me, at least from what I gather, the more promising work is with the microdosing. So is microdosing something you do with ketamine, or is that not a thing?
I haven't really been doing microdosing but I also don't push it.
Okay.
It's kind of finding this sweet spot where someone feels something and they feel something in a very, controlled environment like we were talking about. And I want them to push it a little bit when they're with me to see what the right dose, and you don't want someone who is there for anxiety, PTSD, control issues, who is fearful of where this might take them. You don't want to push it. And
right. Especially if they're out of the office.
Yes.
Right? Yeah.
This is not to knock the IV. I don't know enough about it because I don't administer it. But I feel like with certain patients, you have to really be tuned in on dosing, and with the troches, the lozenges, you can really dial it in.
Okay.
So and add to it and not overshoot.
Okay.
Yeah.
And I know that one of the goals for a lot of people in the field is to eventually get to a point where you don't need anything.
Yes.
As far as medicines or chemicals or substances, it's all internal now. You learn the skills that you need to get through life. Life's hard. life is not easy, and life is hard, and it doesn't get easier. I don't mean that in a depressing manner. It's just life's got stuff, and as we go through life, we have more and more stuff. So it's a matter of learning these skills
as things come at you.
Yeah, and these medicines help you rewire. You learn the skills, and now you kind of a maintenance kind of.
And you practice it like meditation.
Yeah, right.
You know, meditation is wonderful, but if you become like the guru at meditation and you stop meditating, then it's gone.
Exactly.
So you really have to practice.
Practice it, yeah. And it's we've talked about a couple of things here. One is intention, and it's kind of as simple as it sounds. What's my intention? And again, I'm going to take the garbage out, but I want to, have work on this breath work, and I want to calm my mind, and I want to quiet the noise, and
I want to be kinder to myself.
Correct,
Some people
right.
can't even come up with, like I say, 5 kind things,
Right.
5, irrefutable, kind things that you could say to yourself. They can't. They're
Some people
struggling
can't do
for
it.
one.
Yeah, and that's hard. That's hard because. I don't mean this in a patronizing manner, but I feel bad for people in those situations. And I've been in those situations. I am in those situations at times.
We all
you're hard
are.
on yourself. I'm my own worst critic. And,
Oh gosh!
right?
Ignorance is bliss. Right? They don't say that for a reason.
Right? And you break that. Another thing is you mentioned like journaling. At the end of the day, you write out. What happened to you that day? And for me, that entails quite a bit of gratitude. I have found that on my worst day, the list of things I am grateful for is massive. And I forget that.
So true.
And I get caught up in that loop, and I don't think about those things. But if I stop myself, the list is always big. The things to be grateful for.
Gratitude
Right?
never hurts. And also having those tangible, it sounds silly, like affirmations, good enough, smart enough, and gosh darn if people like me. But if it's so challenging for you to even come up with them in the first place, to have them in front of you as something tangible really helps people, because at one point they were struggling to even come up with one. So to look at it and own it and say, I was able to write these down.
It's a big deal.
Yeah.
Right?
So that's like working a program in a sense, where you're reading this and incorporating gratitude. I love that.
Right. So let me ask you, Dr. Hollen, if you can, you may not be able to, if you could kind of summarize in like one paragraph or a couple of sentences, like a mission statement, if you will, about ketamine-assisted therapy. Could you do that? What would that be?
It would be ketamine-assisted therapy is not simply about inducing altered states. Right. It is about helping patients use a temporary period of enhanced flexibility to create lasting psychological change.
Beautiful. That kind of summarizes everything we've been talking about, right?
Yeah.
You get this plasticity. You now teach them the skills to then rewire.
Yes.
But you rewire too to this, and then you end up with the lasting changes.
Yeah,
That's
I really
beautiful,
like that.
Right? Yeah, absolutely. That's beautiful. It really kind of sums the last 30 minutes up pretty nicely. I'm wondering to myself, why is this becoming such a big topic now? And I think some of it is that our society now, we're overloaded, we're burnt out, we're stressed. We got things coming at us at 1,000,000 miles an hour.
Certain things ain't working anymore.
Things aren't working now. I think that there's a growing, I don't know if I say disdain, but there's a growing negative outlook on the pharmaceutical industry, and people want other options. I don't like the A word, alternative, because this isn't alternative stuff at all. Ketamine's mainstream, right?
Yeah, it's been around since the 1960s.
Right.
It's used in, the emergency
Exactly
room.
right.
It's used in surgeries.
Right.
It's,
and but because of the Controlled Substances Act in 1970, it just put a halt on everything else. It didn't mean that those things are bad and have no benefits. It just meant that they threw the baby out with the bathwater. Right, exactly.
Tracks, yes.
So you mentioned ketamine. I've used ketamine quite a bit in my clinical practice. When I was in my residency.
For your peds patients?
Well, I was in my residency in Chicago. Whenever we would go to the emergency room to set a broken bone in a child, we would always use it in children. But that was about it. And then I'd say over the last 10 years or so, it's pretty widespread used in the emergency room to set broken bones or put a dislocated shoulder back in socket. But when I went to Haiti, I've been to Haiti almost 20 times doing orthopedic work. And I was first there like 3 days after the earthquake in 2010. And we literally were operating on picnic tables under a mango tree. And all we had was ketamine. And you can do any kind of operation.
With enough ketamine.
Yeah, absolutely. And that's what we got by with for a while. But, excuse me.
That speaks to the safety.
Correct. It's massively safe, right?
Yes.
Yeah, but when was it started? When was it started to be used as in this arena?
I know in the 1960s is when it was started as an anesthetic,
right.
but not an anesthetic in the way that, not like propofol, more like that dissociative property. I'm not sure when it started to be used.
For psychological, psychiatric thing, okay.
I know it was the first FDA approved modality or form is the esketamine Spravato. The IV and the troches are not.
That long ago,
are not.
Okay.
Yeah.
All right. Well, this is so exciting. So this is wonderful stuff. I'm amazingly optimistic about what lies ahead for us, but it's not for everybody. I mean, certain patients absolutely should not ever consider psychedelics. I know some certain psychiatric diagnoses like schizophrenia. What are some of the things that are reasons why people should not even consider doing this?
Well, someone who's actively in treatment for substance abuse.
Okay.
However, if, like you were talking, the Ibogaine,
right.
that would be different.
Right.
I'm not ruling out someone who had previous substance history who has, their sobriety, years of sobriety, behind them.
Right.
People who are very, very anxious.
Okay.
I still don't shy away from it. That's where I use these, it's almost a joke, like licking a pill or licking a troche. Right. But those are the patients that, again, not to dissuade people from the IV version or Spravato, which I think is great. Okay. But I have found with the troches that you could literally lick. Use the tiniest, get very...
You titrating
a lot better because I would think, someone's very scared. They're scared to feel out of control. Right. They're scared, what is this going to make me feel like? Well, give them a sub-therapeutic, nothing dose.
Right.
That, like you said, maybe you feel almost nothing on, and then you can add to it.
Okay.
And go from there. But if someone is very, very anxious, someone with like a post-traumatic stress disorder, I would start very, very slowly.
Okay.
Yes.
And then other than schizophrenia, are there an active psychosis? Are there any other hard stops?
Bipolar, major depression with psychosis, if they're actively psychotic, if anyone's actively psychotic.
You can't be taking these things.
Yeah, you don't want to, turn someone manic or flip someone into mania. You want to steer clear of these.
Okay, good. Well, this has all been great stuff. I really appreciate you taking the time again, Dr. Hollen.
Thank you for
Dr. Hollen's here in the
having me.
Sarasota area. Anybody interested? All her contact information will be up in the description. It'll be on the website under our resource pages. But I would encourage you to reach out to Dr. Hollen for not only this, but for anything. Like I said, life's hard. Life is hard, and we all could use a little help from our friends, so to speak. And and not just in the ketamine arena, but certainly anyone interested in something like this, I would encourage you to reach out to Dr. Hollen and see what kind of good things she can do for you.
Thank you, Doc.
Absolutely. And to our audience, I hope you got something out of this. We just scratched the surface. I mean, this is a huge field of study. I'm extremely excited. I've been saying for the last few years that I feel the next big thing in medicine is going to be this.
We'll be talking
Psychedelics for
more
mental
about
health.
this.
Absolutely.
Yes.
And there are retreat centers around the world. There's some in Oregon because they've got lighter laws. But as far as it being done right and done well in the proper setting, as soon as they change the laws in this country, we're going to see treatment centers, retreats, so to speak, open up here in the country, and then we'll really see a lot more good come of this, I think.
Yes, I agree.
Again, thank you everybody for joining us.
Happy Mother's Day.
Happy Mother's Day out there to all the moms. And I hope you got something out of this. I know I did. I say that every episode, but it's true. I gain a lot out of this, especially from a wonderful guest like Dr. Hollen. And until next time,
thank you.
Thanks for joining us. Hi, I'm Dr. David Sugar, a doctor here in Florida, and thank you for joining us on our podcast. A quick note, this is for educational and general information purposes only. Listening to this podcast does not constitute a doctor-patient relationship, and please consult with your own healthcare provider before making any changes to your own care. If you are having a medical emergency, please call 911 or your local emergency number. Any items, tests, medications that we talk about or discuss are for information purposes only and are not an endorsement. Once again, thank you for joining us, and please see the website for the full disclosure and waiver. Thank you very much.